Hello, everybody. This is Dr. Connors. Welcome to another live webinar. We have a bunch of questions that people had submitted, and then we'll open it up for questions of the rest of the people that are on here. So let's jump in. Understand also when I answer these questions, I may answer some questions with I can't answer that question. So I'm not afraid to show my ignorance to anybody, and I'm not afraid to stay within our boundaries of what we can do legally too. So just to understand that, I'll explain that as we go. I have chronic Lyme with multiple co-infections. Have you had success treating this type of patient? Have recently experienced some digestive distress. Since you don't see people in your office, do you practice kinesiology virtually? If so, do you feel it's as accurate helping a patient to heal? So first I'll address that part. Yes, I do think distance kinesiology is just as accurate as helping a person in the office, and it can be even better because it does take out some of the maybe pre-existing bias as you're talking to a person and such. So I think it actually can be more accurate. Of course, kinesiology is a technique that is basically an art form, and you, I think, personally want to go to somebody who's praying over your situation and your cheek swab as you do it. That's just my belief. So have I treated people with chronic Lyme disease? I believe that just about every chronic Lyme disease is not just Borrelia. Borrelia burgdorferi is the bacteria that's technically responsible for Lyme disease, but it has multiple co-infections that go along with it. Really, when you see somebody with chronic Lyme, they have multiple co-infections. So it just is what it is. We used to see I've seen 1,000 Lyme patients over the years of helping people with dealing with chronic Lyme, and I'm not exaggerating. Um, we've had a lot of success, but the success depends on multiple factors. It depends on how far the patient is willing to go and doing the things that they need to deal with. And I explain a lot of this on the Lyme course. Now, our Lyme course, we just dropped the prices of our course for a period of time to literally 1/3 the cost. So it's only $197 for the Lyme course. It's super cheap to find out some of the information that I'm going to tell you right now. But you have to deal with it's not about, everybody thinks they have Lyme and multiple co-infections. It's all about killing those things. That's a small component of what you have to deal with. You have to deal with what is stimulating an immune response. You may have had Lyme and multiple co-infections. You have to find out, is it still an active infection? Most of the time with chronic Lyme and co-infections, it's not an active infection anymore. You're dealing with the damage that it's been done. Many times neurologically, upper motor neuron brain type issues, that it's caused inflammation in the brain and it's damaged microglial cells, and that's what you're really dealing with. Second thing that you're dealing with any chronic disease, chronic Lyme included, is that you're dealing with antibodies to self-tissue. It's moved to the point of an autoimmune disease. You've created antibodies to self-tissue. And once you do that, now it's really not the Lyme you're dealing with, it's the autoimmune disease you're dealing with. And that's a whole other ball of wax. So the chronic Lyme course is really good. The new course that I just launched is the chronic disease and autoimmune disease course. It is even better. So really, I probably recommend that one. That's where you really dig into testing for antibodies, testing the immune system in a way that you just can't do any other. You just really need to look at some deep things on the immune response to be able to deal with this. Yes, we've had really good success with people over the years with chronic Lyme disease. Looking for guidance with stage 4 prostate cancer, particularly diet and supplements. So, with any metastatic cancer, it's a little bit different than just the primary cancer. So with prostate cancer, there are some specific nutrients that you want to look at. that can be beneficial. With stage 4, it really depends on what other care that you've done. If you're currently doing androgen deprivation therapy, meaning a drug that's getting rid of your testosterone, then you do want to add some very specific things back. Andrographis is the thing that you want to make sure that you're adding for a nutritional herb if you're on androgen deprivation therapy. I do have a blog post about that. If you go back to our website and search prostate cancer on the blog, you'll see my article about that and some specific nutrient that you want to look at. So as far as diet and supplements, you can look at our blog under prostate cancer and you can search that. Highly recommend, if you're a person that's listening to this and you have cancer and hey, I maybe you financially can't afford to get a Rife, or you can't afford to do our full program or anything, go and spend a few $100s and join the Stop Fighting Cancer course. Again, it's one of the courses that we dropped to $197 for a limited time. I don't know how long we're going to keep it at that, but it's worth 10 times that much. You really should look at that course and dig into that. On that course, I have different protocols for every different cancer. So that will give you some specifics. As far as diet with any cancer, I can say overall, the most common thing that can drive a cancer, people say sugar. Yes, of course, everybody should be on a low sugar, a low simple sugar diet. But dairy is the more overlooked one. Dairy, cow's milk, goat's milk, has nutrients in it to make a baby cow or baby goat grow fast and to a very big cow and a very big goat. Those are growth factors that are in all dairy products, not eggs. Eggs aren't dairy. That's from a chicken. Anything that's coming out of an udder has growth factors in it. That's one thing that you should stay away from. Can someone use things like the Rife machine or infrared saunas or PEMF if you're on immunomodulatory drugs or monoclonal antibodies for cancer? Does it interfere with the effectiveness of the cancer drugs? So the Rife machine does not, and I would say the PEMF does not interfere with those drugs. Of course, I'm not a pharmacist, so you take that into consideration, but the frequencies are not going to interfere with drugs. Infrared saunas may. So anything that you're going to do if you're on a medication for a cancer and you're increasing your ability to detoxify, and that's why you would do an infrared sauna, it can decrease the effectiveness of the drug because you will increase the rate of detoxification of that drug. So that I would talk to your doctor about, your oncologist about doing saunas or coffee enemas or doing heavy detox nutrients when you're on a specific drug for cancer. You'd better need to talk to them about that. The Rife machine and the PEMF, no, you could do that. If you're running Rife frequencies for cancer along with your cancer drugs, there's no problem. PEMF is stimulating cell membrane potential, increasing the charge of the cell membrane, decreasing pain. So that's not going to interfere with drugs, any of these kind of drugs. So no. I feel that the primary focus of my Lyme, Bartonella babesia infection is my head, including brain, eyes, and jaw. For example, I recently had a tooth extracted, left-sided jaw, and the lab test found the tooth to be infected with all three of these things. In addition, I often feel the presence of something too small to see in my left eye. Is there any way of determining where a Lyme, Bartonella babesia infection may be localized? Is it safe to hold the Rife electrodes near the head when running a frequency treatment? Well, first I'll address the last part of this question. Is it safe to hold the Rife electrode? So I'm not sure what Rife machine you're using. So if you're using one that has electrodes instead of a bulb and using light frequency, I don't, there's to me, just a lot less efficacy of that. So the Rife machine that we use uses light frequency. And yes, you could put the bulb up next to your head. You could put it up by your eye. There's no harm in doing anything like that. If you're using a Rife machine that's using pads, you're really using electrical frequency, and no, you should not put that up by your head. So the general rule of thumb with any electrical frequency like a PEMF, TENS unit, Rife pads, is you got to be careful using it by your head. Now, I know that you can use electrical frequency on your head. Matter of fact, there's PEMF devices that are specifically designed to use on your head for astrocytoma and glioblastoma, but that's somebody professionally is helping you with that. So I would be careful about putting it up towards your head if you have pads. It's really an electrical frequency machine, not a light frequency machine. I often feel presence of something too small to see on my left eye. Is there any way of determining where the localized infection is? Not through any lab testing that's out there. Is there a way to test where it's located? The only way you could do is take a tissue sample and test that tissue sample. And there's no labs that are doing that for Lyme that I know of right now. So, now I did say that in a previous question that often chronic Lyme, chronic disease, chronic toxicity issues, chronic mold issues can end up causing what's called an upper motor neuron lesion or issues with the brain, meaning that if it crosses the blood-brain barrier, it can damage neurons. It can damage, tissue in the brain. If it damages the immune cell in the brain is called the microglial cell. If it damages that microglial cell, and I say if because it's very common that happens, that microglial cell is called a primed microglial cell. And then that primed microglial cell can sit in two different states. One of those states is that it's just spewing out an inflammatory chemical patterns. These inflammatory chemicals are called cytokines. So it's just sitting in this prime state that's spilling and kicking out inflammation at all times. That's the problem with damaged microglial or prime microglial cells. It's not uncommon that Lyme, mold, heavy metal toxicity, toxicity to vaccinations, toxicity to other biotoxins can cause microglial priming, also post-concussive syndrome. That's where most of the research comes from. So that is an issue that needs to be dealt with. So that's a whole other piece. I do have a video on neuroinflammation that explains microglial priming that can be beneficial. And that's where people with Lyme think, well, I got to kill the Lyme, and they can actually do more damage than good. So you want to test for those things. You also want to test for the next worst step in brain issue and inflammation of the brain is you can end up developing antibodies to neuronal tissue. And there is a test that you can test for that. It's called the Cyrex Array 7X, which is the best test for neuronal antibodies. And that will give you a really good picture of exactly what's going on in the brain. And for a lot of our members, it's just like, oh my gosh, I thought I was going crazy. Now I know why I have these issues. And now at least I can sanely work through them. You can't magically make those things go away once those things exist. There's argument whether they'll ever go away, but you can help manage that. And that is just a lifetime lifestyle changes, and it's a process. What is the best way to deal with metastasized testicular cancer in general? Well, there isn't a really general way to deal with any metastasized cancer, or whether it's metastasized from testicular cancer, ovarian cancer, colon cancer. You do have to manage the area that it's metastasized to. Remember, if you have testicular cancer and it metastasized to the liver, it's not liver cancer, it's testicular cancer in the liver. Most common spot for testicular cancer to metastasize is the bone and the lumbar spine and the pelvis. It's not bone cancer, it's still testicular cancer. So you still have to deal with it the way you should be dealing with the primary cancer. And if you're using standards of care, they're going to be using chemotherapy and radiation. If you're not using standards of care, my opinion is you absolutely better be using the Rife machine and nutrition and specific nutrition and diet. You should get tested for that. And that's look into our Stop Fighting Cancer course or our full membership to really dig into that. If you have metastasis to the bone, you have to deal with that, because if you have bone that has cancer in it, it's 99% of the time, metastatic cancer to bone will be lytic, which means it'll be eating away or eroding the bone, so you'll lose bone density. If it's a weight-bearing bone, like your lumbar spine, you can end up with what's called a pathological fracture. So even if a person's like totally against standards of care, I don't want to go down that route, I recommend people do consult with a radiation oncologist, because you want to kill the cancer in the area. That's where radiation could really shine. So doing radiation specifically to that, L2 vertebral body can kill the cancer, and it can save the bone and save a world of hurt from a pathological fracture. What should I do? Same person asked this question about very high calcium and creatine levels resulting from metastatic testicular cancer to the lymph nodes. Well, I'll tell you right now, very high blood calcium levels is not a sign of testicular cancer to the lymph nodes. It's a sign of metastatic cancer of any kind to the bone. So if you have high blood calcium levels, another sign of metastasis of the bone is high blood alkaline phosphatase levels. If you have high blood calcium level, it's coming from the bone. So you do want to look at that. Creatine is going to be coming from the liver and the muscle. The kidney and the muscle. Doesn't mean it's metastasized kidney, but it's the way it's processed through the kidney. You're going to have high creatine levels. But high blood calcium is a sign that you have metastasis to the bone. You better be looking for that, making sure that you get a CT scan and a PET scan to get proper analysis of exactly what's going on. And then go back to that last question about that I addressed. Make sure that you address that in the bone, if it's in a weight-bearing bone especially. How can I keep healthy since I have had chemo and now I am on an estrogen blocker? What kind of nutrition or meals should I consume? How can my diet prevent new cells from forming? Well, that's a lot of education that needs to be done there. I mean, you could at the very least download the first chapter of my Stop Fighting Cancer book on our website. That's free. The next step is to buy the Stop Fighting Cancer book and read that. I know it's a mouthful, or it's a lot of headspace, 600 pages, but you need to start educating on some things that could drive cancer. I mentioned earlier, for this person, I don't know who it is that asked the question, but that definitely dairy, definitely sugar. You want to decrease the consumption of those. Don't make it a religion, but you need to decrease this consumption of those things. Cancer can be fed through glycolysis primarily, and that's where you hear about cancer feeds on sugar, but not always. Some cancers can be fed through amino acids, and typically glutamine and methionine. So, a keto diet is not right for everybody. Keto decreases blood sugar and helps your body feed mainly off of ketones, but it's typically very high in animal protein, and it is very high in glutamine and methionine. If your cancer is fed on that, then you are basically feeding the cancer. So there's no perfect way to tell that. If you're a full member, we do cheek swab testing to find that out. But in general, you should stay away from dairy. You should stay away from sugar. And eat a moderate diet. Should everybody go on a plant-based diet and not eat animal protein? No, I don't think so. I don't think that's healthy, especially if you have genetic considerations with the methionine pathway. You're going to feel way worse. You're going to feel you're going to be much less healthy being on a plant-based diet. So be careful of fad diets like that. Just because it's real big in, today's society being plant-based, don't think that that's good for you. So it can be good for you, but it can be really bad for you. So, without getting tested, just balance is best. And if you're on an estrogen blocker, you don't want to be adding anything to your diet that's going to feed estrogen. So you want to make sure you're staying away from soy products and things like that. Be careful of BPAs and plastics, anything that's going to increase exogenous estrogens as well. Also, make sure you're taking, if you're on an estrogen blocker, you really should be on a binder as well, like charcoal, sodium alginate, fumic acid, humic acid, those kind of things that will bind things in the gut. Estrogen is the number one thing that's reabsorbed in your large intestine. So I talk about different binders in all my courses. So that's something to look at too. Okay, that was the last submitted question. If you have a question, you can unmute yourself and verbalize your question, or you can ask it in the chat. We got a few minutes left, so feel free to jump in. If a person was facing uterine cancer, would you recommend removal of the uterus? Well, that's one of those questions I can't legally answer. So that's a question you're going to have to discuss with your surgeon and your oncologist. I can't tell a person to remove their uterus or not. Certainly, if a person is of age that, hey, I'm not going to be using my uterus, I don't want to have any more children. So removing the uterus with uterine cancer is a process. What it's called, a surgery that's called debulking. So it's the same thing with, I'm going to remove my prostate, or I'm going to remove my breast because I have breast cancer. In one sense, it makes a lot of sense. You're removing that organ, you're getting the cancer. If it's contained to the organ, you're removing the whole thing. The chance of survival, you just think about it, makes sense. It goes way up because you're debulking the cancer. Then if you do a bunch of natural things to help, because definitely by the time a person has a diagnosis of cancer, they have given off lots of circulating tumor cells. And those circulating tumor cells are cancer stem cells that are just circulating through the body. They're not yet, quote unquote, cancer cells. They're just looking for a home, looking for a place to set up home and raise a family. That's what's called metastasis. So just because you debulk a cancer, just because I do a double mastectomy, does not mean that I'm in the clear and I'm never going to have metastasis down the road. It doesn't. And statistically, it doesn't. So but it still can be the smartest idea. So, I mean, just think about it. If I could remove the mass, and so my immune system doesn't have to fight against trying to destroy this cancer, this growing mass. If I can have surgery to debulk the cancer, then I can build up my immune system to kill any circulating tumor cells and to build my immune system so they never get a chance to grow and such. So it does make sense. So I can't answer whether you should do that or not, but I can walk you through just like the logic of that. Genetics course. Will this help me understand what supplements and diet to use and not to use? Already had a genetic profile done. So if you just get the genetics course, so quite honestly, nobody just buys the genetic course. So if you had your genetics done somewhere else and you just want to learn more about genetics, well, then do the genetics course. But no, if you've had your genetics done somewhere else and you just get the genetics course, it'll give you some ideas, but you're going to have to formulate that yourself. You're not going to get a plan from us. The genetics course is included with if a person does their full genetics with us. then it really helps them understand my recommendations and why I recommended it. And it is based upon the genetic profile that we use, which is I think, the most comprehensive genetic profile that exists today. So um, if you had your genetics done somewhere else and you just want to learn more about it, sure, take the course. I just don't want you to be disappointed. You're not going to get a specific protocol from us. I have been diagnosed with CCIS stage 1. The treatment is lumpectomy, radiation, estrogen blocker. I'm reluctant to do the radiation and drugs. Are there good options? Again, I can't tell you to do or not to do a medical procedure, but there are other options. You certainly are on this call because you're trying to explore it. The next step again would be to read my book and other books that are out there, and you'll see that there's a lot of women that decided not to go down the road at all. There's a lot of women that decided to do some things, but not everything. We have a lot of members that are in that category. They might have done some medical intervention and then they decided to stop and they want to do all natural from here, or put it off as long as they can. And so there are other good options. And then the next step beyond reading books would be to join the Stop Fighting Cancer course. That would be a lot of good information and videos in there for you too. Can you discuss the use of binders a bit? How do you keep binders from binding the supplements you're taking? So typically you don't have that problem with binders. Binders are not going to specifically grab onto curcumin and pull it out of your body. So that's really not an issue. Can a person take too many binders, taking too much charcoal or too much humic acid? Yeah, you can take too much of anything, but if you just stay on the bottle, like our product called Clear Binder, it's actually called Phase 5 Clear Binder because I talk about binding in the detoxification course. So the 7 phases of detoxification. Maybe that'd be a good book to get. That's on Amazon. You can download it on our website. And in phase 5 is binding stuff that's in the gut, so you don't reabsorb it. So just if you took like our Clear Binder, Phase 5 Clear Binder, you just took it, just followed what's on the bottle. I think it's 2 or 3 a day. You're going to be fine. It's not going to be binding supplements. So I wouldn't be concerned about that. Explain the difference between a saliva test and a urine test for hormone testing, which is more accurate or best for determining breast cancer treatment. Well, neither one's going to determine treatment, but the urine test is far more superior. Don't even think about doing a saliva test when you're talking about estrogen, progesterone, testosterone, and all the metabolites of that. So the Dutch test is the most accurate test out there. And I like the Precision Dutch test. We have it on our store. If you want to order it, you can. It's a urine test that you do at home. The one we use does have a saliva component, but that's measuring cortisol, not measuring the estrogen, progesterone, or the androgens. So that's that test. So is it to help determine breast cancer treatment? Well, I guess yes and no. If you have an elevated 4-hydroxyestrone, 16-hydroxyestrone, you're looking at methylated estrogens. Yes, if those are elevated, you certainly want to get on. If you're going to go natural, you want to get on, natural aromatase inhibitors, which is DIM and IC3 and sulforozyme and all sorts of things like that. And I have multiple blog posts on that, so you can look at natural, or you can just search our blog for aromatase and that will come up. But you'd want to do those things anyway. So like if a person became a member of ours and they're like, oh, should I do a Dutch test right away? No, you don't really need, we're going to do those things anyway. So we have a lot of people that choose to do a Dutch test because they want to see the balance of their hormones. And by the time we do the Dutch test, their quote unquote bad estrogens are way down. So And I've seen that literally 100 times. So I don't recommend that people spend the money on the Dutch test really because of that, because we're going to be doing so many things to lower the bad estrogen levels down that they work. So we don't need to do a Dutch test, but certainly can. We have people that do because they're curious. So, and I love to look at the test anyhow. So, will you please comment on multiple myeloma? What successes or failures have you experienced? Again, we can't say successes or failures. We're an alternative cancer support center. Don't treat cancer. So if you call us and say, what's your success rate? That's the answer you're going to get. And it's not just from legal mumbo jumbo. I mean, we treat the person, not the disease. So, and we don't treat cancer. We don't diagnose. We don't treat cancer at all. So um, we've had a lot of people with multiple myeloma that have done real well. Most of our members with multiple myeloma have coupled it with standards of care as well. Um, Multiple myeloma can be in what's called a smoldering phase, where it's kind of in a state of quiet remission. And I think with natural methods, not just ours, but all sorts of natural methods, you can prolong the smoldering phase and give a person a much better quality of life. I know there's oncologists that try to be conservative with their treatment. Most oncologists today are very aggressive with multiple myeloma. They'll put them on the chemotherapy drugs for like ever. And it doesn't make you feel good. It's got a whole bunch of side effects, and a lot of patients don't want to be on it. So if they can couple, treatment with natural ways so that they can cycle on and off those things, and they're constantly looking at their numbers, because multiple myeloma is easily monitored through measuring your blood levels. So you can see, hey, I'm still hanging in there. I'm not going to go back on the drug again for a little while. And so that's the way we've helped people through multiple myeloma. And we have a number of people with that right now. What's the difference between Rife frequencies that come with the true Rife and the ones that you create? Well, the ones that we create are specific to the person and specific to whatever the person's diagnosis is. So if somebody calls us and say, hey, I want to buy a Rife. Okay, do you have a disease or a diagnosis? No, I just want to buy a Rife for my family and just run it for the kids and stuff. And well, then just go to True Rife and just buy it from True Rife. But if they call us and say, no, I have, colon cancer, well, then certainly, it's better to get a specific program that's for you, for your disease, that you can run. And we write programs for cancer programs for overnight use, or Lyme programs for overnight use that a person can use. And you get our frequency course with it and everything. So it's better. But we're not trying to sell people stuff. So if they don't need us and my programming, then by all means, just go to True Rife and buy it. It's cheaper. So, we just want what's best for you. Can Rife frequencies be used diagnostically? Wow, that's a great question. Easy answer, though. The answer is no. So there are machines out there that you might go to a practitioner and you put your hand on a little cradle and it scans your hand for frequencies, and the practitioner may say, hey, the frequency for parasites came up, or the frequency for heavy metals came up, and they might then go the next step, which I think is wrong, and say, this means you have this parasite. Sorry, if you scan yourself with a Rife, with any frequency device, and you get what's called a hit on that frequency, it does not mean you have that disease. That is malpractice. I'm sorry, but it's just wrong. So you means you have a hit on that frequency, and it might be good that you ran that frequency because it can be helpful, but it does not equate to a diagnosis. So we get people come to us that say that all the time, that, oh, I went to my naturopath and they did this test, and there's a whole bunch of different machines out there that do that test, and gave me this readout and said that I have candida again. Well, okay, that does not mean you have candida. That is not a diagnostic test for candida. It means that you might have had a hit on a candida frequency, but there could have been other reasons why you even had that hit that had nothing to do with candida. Lots of reasons. I won't go to it now, but that is not diagnostic. So you do not use Rife frequencies diagnostically. And I know some practitioners disagree with me, but I just don't think I'm wrong with that. So no. Good question though. Okay, I missed a question there. Are there certain supplements you could recommend to take with the Rife machine to help take toxins out? Um, really, the honest answer to that question is you really need to read my 7 Phases of Detox book, or go the next step and buy the course, my 7 Phases of Detox, because that question carries danger in it. So most people think the way I think you're thinking. Like, I want a detox. So what supplements can I take to help pull toxins out of my body? Logical question, right? But that's a dangerous question, because if you start taking, if I answered that question and said, well, yeah, you should use some chelators, that chelators pull toxins out of your tissues. Huge danger in that. If you start pulling toxins out of your tissue, that's what I call phase 0 detoxification pathway, is you have toxins in your cells. That's what's the cause of cancer most of the time. You have toxins in your extracellular spaces. You have toxins that flow through your bloodstream after exposure. And the idea is to get those out of your body. But your body has a way of doing it. That blood has to go through your liver. That's how you get rid of anything. So even if you start taking a chelator, which is a substance like DMSA and EDTA and other chelators, even mild chelators like cilantro and things like that, you start taking those things. Well, that makes sense. My practitioner told me to start taking these because my test showed, my hair analysis showed heavy metal toxins. Hugely dangerous unless you're dealing with downstream effects of detoxification. So you start pulling stuff out of the tissue and your liver can't handle that. All that's going to do is circulate around and be deposited somewhere else in your body and make you sicker. Second worst case scenario is your liver is able to handle that, and it becomes more toxic and overburdens the liver and causes liver issues. Third case scenario, let's say if your liver pathways are doing really well and open, it could overwhelm your gallbladder and affect your bile and your bile flow and your bile duct. And that can be a cause of, worst case scenario, cancer there. And then downstream. So you have to go back to understand the 7 phases of detoxification. Phase 6 is where you got to start. How are your bowel movements? Are you having daily bowel movements, more than one bowel movement? Are you getting out everything that's on the inside? That's a huge thing. That's where you got to start. Then phase 5 is, are you grabbing onto toxins in the colon? So anything that your liver works so blasted hard to get rid of and dump into the small intestine that you're not reabsorbing along the way because you have a damaged gut wall called leaky gut syndrome. Did you deal with that yet? If you haven't dealt with that yet, and you're not taking binders to make sure you're not reabsorbing things, you have no business chelating stuff out of tissues. Then phase 4 is, have you supported the bile duct, and the gallbladder? Hugely important, because if you got stasis in the gallbladder, you could end up with major gallstone issues if you start with chelation. Then you got to go to phase 3, 2, and 1. That's in the liver, and the only proper way to assess that is through genetics. And once you look at your cytochrome P450 pathways, your PON1 pathways, and your NAT pathways and such, and your glutathione pathways, and you start supporting those after you've supported 654, then you're supporting 321. Now you can start chelating stuff out of the tissue. I know that was more than you probably wanted in that answer, but it's the right answer. And you could, look at my 7 Phases of Detox book to get more detail on that, or if you want to dig into the course, you could do that as well. Any other questions? If you're on an estrogen blocker, should experience cycle symptoms? If so, what can be done to reduce that? If you're on an estrogen blocker, you are going to go through, menopause. So even if you're in menopause, you're going to go through a deeper menopause. So even in menopause, you're still making estrogen and progesterone, maybe not at all from the ovaries, but you will still, your adrenal glands still make estrogen and progesterone, even if you had your ovaries removed. And that's what keeps semi-level hormone balance in your body. If you're on an estrogen blocker, you're going to lose all your estrogens, and you're going to go through a deeper menopause. And there's really nothing if you do something about that, like take a supplement with soy, or that's going to help balance hormones and such, you could actually stimulate your adrenals to create more. As you're really you're negating the effects of the estrogen blocker. So that's what a lot of women don't like. If they have ER or HER2 positive cancer and they go on a aromatase inhibitor, they feel horrible. And that's a number one reason. It's one of the big reasons why people call our office. They don't want to do the medical procedure anymore. I want to do a natural procedure, which none of the natural aromatase inhibitors are going to put you into a basically drug-induced, complete loss of estrogens. So it's hard, if we have people that are on aromatase inhibitors and they're like, oh my gosh, I have the worst hot flashes, I have the worst symptoms. What can I do about it? Well, that means it's working. There's not really anything you could really do about that. They are going, can I take maca? Can I do a bunch of adaptogens? Yeah, but you just got to be careful that you don't start stimulating more estrogen production. That's why you're decreasing the side effects of the lack of estrogen. Do you offer a package that does not include the purchase of the Rife if a person already has a Rife but needs special programming? You can call the office about that. I'm not actually completely sure about that, so call the office about that. All right, I think we're going to call it a night. Thanks everybody for being on tonight, and I will probably be doing another one of these next month, and I will let you know it'll be up on the website. So, all right, know that I'm praying for you. I love you all, and know that God has you in his hand no matter what struggle you're going through. All right, bye-bye.